Hi, this is Sarah back again, and now we're going to talk about dissociative disorders. There are a couple of different types of dissociative disorders. There's dissociative amnesia, there's dissociative identity disorder, or DID, and then there's depersonalization and derealization disorder. Now, with dissociative amnesia, this is defined as an inability to recall important personal information that is too extensive to be explained by ordinary forgetfulness. So, lots of people get forgetful, but with dissociative amnesia, this goes beyond being forgetful. And this inability to recall their memory is not directly due to the direct effects of either substance abuse or a neurological or other medical conditions. So this isn't, we can't tie this back to somebody having like a traumatic brain injury or something like that. Onset of dissociative amnesia usually follows severe psychosocial stress. There are types of disturbances in the recall. There can be localized amnesia. This is the inability to recall all incidents associated with a traumatic event for a specific time period following the event, usually a few hours to a few days following the event. There's selective amnesia. This is the ability to recall only certain incidents associated with that traumatic event for a specific time period following the event. And then there's generalized amnesia, and this is the inability to recall anything that has happened during the individual's entire lifetime, including their personal identity or who they are. There's also there's also a specific subtype of dissociative amnesia that goes with a dissociative fugue, and this is where there's a sudden the person has a sudden unexpected travel away from their home, during this time, they have the inability to recall some or all of one of their past. So, for instance, somebody who is a businessman in Texas, in Austin, Texas, goes into a dissociative fugue. He disappears. Family doesn't know where he is. Nobody knows where he is. And 5 years later, he's found in Seattle working in a coffee shop for minimum wage. And typically, he won't have any memory of Texas, of his life in Texas, and he'll show up in Seattle or someplace like that, living a very quiet, very, very different lifestyle. Oops, sorry. Okay, sorry about that. Okay, there's also dissociative identity disorder. This is characterized by the existence of two or more personalities within a single individual. The transition from one personality to another is usually sudden, often dramatic, and is usually precipitated by stress. And then there's depersonalization, derealization disorder, and this is characterized by a temporary change in the quality of self-awareness, which often takes the form of feelings of unreality, changes in body image, feelings of detachment from the environment, or a sense of observing oneself from outside the body. Now, depersonalization is defined as a disturbance in the perception of yourself, and derealization is described as an alteration in the perception of the external environment. Symptoms of this type of disorder are often accompanied by anxiety, depression, fear of going insane, obsessive thoughts, somatic complaints, and a disturbance in the subjective sense of time. So, predisposing factors to dissociative disorders. Psychological trauma is a huge one. There's a growing body of evidence that points to the etiology of dissociative identity disorder as a set of traumatic experiences that overwhelm the individual's capacity to cope by any other means than to dissociate from that situation. These experiences usually take the form of severe physical, sexual, or psychological abuse by a parent or significant other in the child's life. DID is thought to serve as a survival strategy for children in this type of traumatic environment. Some common nursing diagnoses for clients with somatic symptom disorder include include ineffective coping, chronic pain, deficient knowledge of psychological causes for their physical symptoms, fear, disturbed sensory perception, self-care deficit, and deficit knowledge. Nursing diagnoses are formulated from the data that is gathered during the assessment phase and with the background knowledge knowing the etiology and the implications for each of these illnesses. So when we're assessing the client in the assessment phase of this, what they tell us is really going to dictate what type of nursing diagnosis we give them. Some common nursing diagnoses with dissociative disorders include impaired memory, powerlessness, risk for suicide, disturbed personal identity, and then disturbed sensory perception. The outcomes that we're looking for with these clients are that the client is able to cope effectively without resorting to those physical symptoms, verbalizes relief from pain, and this can be both physical pain and psychological pain, has decreased frequency of physical complaints, and is able to interpret their body sensations rationally. So if somebody has a headache, they can verbalize, I have a headache, not, oh my gosh, I have a brain tumor. And then they're free from physical disability. The outcomes with dissociative disorder that we're seeking are that the client can recall the events associated with the precipitating stressful situation. They can recall all events of their past life. They can verbalize anxiety, the anxiety that precipitated the dissociation, and they can demonstrate coping mechanisms or methods to avert those dissociative behaviors. Another desirable outcome is that they're able to verbalize the existence of multiple personalities, if that is indeed their instance. But again, that is very, very rare that they have multiple personality disorder. And lastly, excuse me. And lastly, that they're able to maintain a sense of reality during stressful situations. So planning and implementation. Nursing care is going to be aimed at the relief of discomfort from the physical symptoms, improved client coping strategies, and restoring normal thought processes. Nursing care of the individual with somatic symptom disorder is aimed at the relief of the discomfort from the physical symptom. Assistance is provided to the client in an effort to determine strategies for coping with stress by means other than preoccupation with the physical symptoms. Nursing care for the client with dissociative disorder is aimed at restoring normal thought processes, and assistance is provided to the client in an effort to determine strategies for coping with stress by means other than dissociating from the environment. Evaluation is based on the accomplishment of those outcome criteria, and you'll really run the gamut of having goals being met, partially met, or not met at all. You'll really see a wide variety. Some of the medical treatment modalities, there's individual psychotherapy, group psychotherapy, behavioral therapy, psychopharmacology, and you know, as with all other mental illnesses, most insurance plan has a pretty low cap on how much money they will pay for mental illness, and it's usually like $25,000 a year up to $100,000 a year. But if you're in therapy, you know, 3 times a week for 3 hours a day, you're going to blow through that really, really quickly. So, so paying for this can really be a challenge. Other treatments for dissociative disorders, there's individual psychotherapy, hypnosis, supportive care, cognitive therapy, group therapy, psychopharmacology, and integrated therapy.